Hello friends, I am Pawan Dhal, a mental health activist. Today we are going to begin a new podcast series called You Matter, where we are going to talk about frequently asked questions that come from people like you. I am in conversation today with two mental health professionals, Shotovija Majumdar, a clinical psychologist, and Paramita Bhaumik, a psychotherapist. So, to begin with, Shotovija and Paramita, can we have a little introduction to yourself, some information about your journey as a mental health professional?
Okay, so I'm Shratubhisha and I am a clinical psychologist. So my work primarily focuses on trauma-informed, queer, trans-affirmative mental health and addiction. I work with individuals and couples who are going through anxiety, depression, relationship issues, stresses, or simply just they are being overwhelmed by life. And additionally, I also train and supervise early career therapists to build a queer, trans-affirmative, and ethical trauma-informed practice.
Right.
All right. Thank you so for the introduction. My name is Paramita. I am a psychotherapist, and I have been working with couple clients and married clients for a very long time. So in the field of relationship for a very long time. I also see people with individual issues in terms of mental health problems. And also I have been in the field of training mental health awareness, promotion, wellness for quite a long time now. So this is my journey in the field of mental health.
So, my first question is a very common concern. What is mental health in simple terms?
Mental health is none other than physical health concerns. So when we talk about mental health, it does not exclude the physical health part of it,
Right.
because it is more that our body has different organs, and brain is the most important organ which runs all the other organs of the body. So
Right.
when we can be equally concerned about a cardiac health issue, we need to also be concerned about a mental health issue where we feel like depressed, and we feel like anxiety and trauma and so many other things. So I think these are all related concerns of the whole body, and the outcome of the treatment will be mental health and physical health well-being. So health in well-being, the total concept. Yes.
Just as in case of physical body, any organ of the body can fall sick due to maybe virus, maybe infection, maybe low immunity simply. Similarly, our mental health also can get affected. Just because mind is not visible, that doesn't mean that it is not there. Everyone has a mind. So it can also get affected due to probably lack of support, any stress going on, and maybe simply low immunity, like say lack of coping skills. So our mental immunity can also get compromised. In that situation, it is very important that we just don't target the physical body but also the mind.
So now people have a lot of misunderstanding about what mental health is, and a lot of people hesitate. What do you think the reason is? Why do people hesitate for something which is so integral to health itself?
There are a lot of stigma in our society around mental health and mental illnesses. Like, a person may be termed as crazy or pagal. And also it is seen that it is like seen in a way as if you are seeking help, that means you are weak. So talking about your mental health issues out in the open can lead to a lot of shame, and people can criticize, people may dismiss your problem or laugh at you, or you may get judged. So the problem is in society, how society is looking at mental health. So people actually hesitate, and they treat it as if something very secret, like a secret disease or a taboo which they cannot talk about openly. So, and this view definitely needs to be changed.
Right.
Yes, so I mean, what I feel is that there is not much of awareness that mental health can also be a part of the physical health or the whole health concern, because when a child is born, all the focus goes towards the physical health concerns of the children. But when they grow up, unless and until it is something very specific, I mean, the whole concern goes on to a child's, when a child is developing, the physical health concerns are more important, and they are being catered to. But mental health problems like stress and other things which children face in this, I mean, in this world, I mean, in this kind of competitive world, that is generally not taken seriously. So I think that's the gap.
And they are often told that, this is something you should be able to handle on your own, or
Right.
look at other people, they are able to handle it, or maybe others have it worse than you. So it is basically trivialized. So
Right. Okay, so now a lot of people have heard about counseling as an important part of mental health, but there is often no clarity about what exactly counseling is and how is it different from talking to, say, a friend or somebody special in your family or in your life.
Right. So, I mean, talking to a special one in the family or a family member or friends is it's actually a very good thing, because it actually implies the support system that people have. So definitely it helps a lot when they get people get the space for ventilation, emotional ventilation, talking, validation, getting validation, things like that. But counseling is is a very different setup, where there is a person sitting on the other side of the table, or maybe other side of the screen, and there is a professionalism attached to it, and they need to be ethical and non-judgmental about the problems that a client is presenting with, which does not generally happen in a family setup or a friend setup. So unknowingly, knowingly, intentionally, unintentionally, family members or friends, they might end up judging a person, which can be ensured that in a counseling setup that would not happen, because of the ethics and because of the other the technicalities of the process.
Right.
I would like to give an example also here. Say you are talking to a friend and you are asking for an advice, and your friend gives you an advice and you follow that advice, and somehow that advice doesn't land properly, doesn't help you. So naturally, even if you don't want, you may feel that resentment towards your friend, that my friend gave me some suggestion which did not help me. So obviously there is some conflict of interest, and you cannot, maybe you'll not be able to tell that to your friend honestly also, and it would impact your friendship in some way. This is not going to happen in counseling, because first of all, therapist is not your friend. It's a professional relationship, and therapist would never give you direct advice and say do this or don't do this. Therapist will help you in finding your own solution to make you more independent, not being dependent on the therapist. So in that entire process, this very fear which we can have in talking to our friends and family, that is not present when we are talking to a therapist and counselor.
So you mentioned the word therapist. What is the difference between therapy and counseling, or is there a difference?
These two terms are often used interchangeably. They do overlap, but there is some difference. They are not identical. Both therapy and counseling, both are evidence-based, structured, and a confidential professional relationship between our client and client or clients and the professional. But in case of counseling, it is more of guidance regarding your life stressors and adjustment issues, right? But therapy is something, psychotherapy, it goes much deeper. It includes a very detailed assessment. It can include some diagnostic assessment, and also understanding the long-standing pattern, if there is any trauma history, and relationship difficulties, interpersonal challenges. So it goes much deeper to your childhood to understand how everything developed eventually over time, and now whatever crisis we are seeing, the roots of the crisis, we go back to that, right? So this is a difference.
Right. So, according to me, this very basic difference which I find in counseling and therapy is that in counseling, mostly people have this expectation that this is my problem, so can you please tell me what to do?
Yeah.
So that comes up in the format of a thing that I'm trying to resolve your problem and I'm suggesting some certain things to do. So that is more or less that happens more or less in the counseling setup. But in therapeutic setup, it is more that the therapist involves the person in the therapeutic process, the assessment process, the therapy framework, and also to work on the client's self-agency, to be involved and to work on themselves. I think that is the crucial difference between providing suggestion and having the client to work on themselves. So that is the primary, difference which I find between counseling and therapy.
Right. Could you both or either one of you give an example of working on themselves? What does that mean?
So first it starts from understanding that yes, I am having some crisis and I need some kind of help. So seeking help is the first step. We know that many people, they do not identify, they fail to identify that they are struggling, and they do not seek help for many reasons, as we discussed before, the stigma and the shame. So understanding that I need help, preparing yourself to actually go and seek that help. So taking accountability of your own life and taking responsibility of your own healing, even if the crises are caused by certain factors in your environment. But end of the day, if I am struggling, I'll have to take some responsibility to, probably improve my coping skills, learn how to deal with the struggles in a better way, how to improve my relationships, how to make better choices. So this is a very, this is a thing which I'll have to do for my life.
Right.
And I'll not be dependent on anybody else for that somebody else would come and make decisions on my behalf. So developing that capacity to make better choices.
Right. So Paramita, please tell us what happens in the first counseling session. What is the role that the psychologist plays?
Right. In the first counseling sessions, people come with a lot of expectations that they would be understood.
Right.
So that's the first thing. So when they start talking about their issues, they want the therapist to relate to them, to relate to their problems, and to get a feedback that the therapist is actually able to reach out to them and help them understand that that what they are actually going through. So that's the first thing. So and in here I feel that actively listening to the client and having certain body postures which help the client to understand that yes, he or she is listening to me, and a sort of empathic resonance that comes about in the session. And so with this, the clients, they feel like grounded, they feel okay, so the person is able to understand me. But sometimes it also happens that often that they feel that maybe the therapist is not able to understand my problem. So in which case at times people drop out from the sessions. So that is one of the challenges that we have felt. And also in the first session, there's the therapeutic alliance, building therapeutic alliance is something very important. And that is why, so that the dropout doesn't happen. So therapeutic alliance is the most important thing. And understanding the problem, understanding the problem in a broad way, in a broad manner, and then helping, paraphrasing and helping the client to feel that, these could be the probable solutions that we are looking up, but we have to work on this together. It's a collaborative process.
Right.
Yes. I would like to point out, like, add on to what she is telling, that people come with, obviously, whenever we go to any professional for any service, we go there with certain expectations. As she mentioned, that yes, the expectation that I'll be understood, that is very basic and very much valid. And apart from the valid expectations, also at times we have seen in our practice that people come with some expectations which may not be very helpful. Like, I'll be cured immediately. In one session, I'll find some magical solution, and the therapist would, do some magic, and all my problems would disappear. This is something which we struggle a lot with, because therapy is not a quick solution. It's not a magical solution that in one single session all the problems which the person is probably has been facing for last couple of years, that cannot just disappear in one single session of, say, 40 minutes or 1 hour, right? So this is one expectation which at times, as she was talking about dropout, it leads to dropout, because when the people see that, okay, my problem is still there, then they feel like, okay, it is not working, therapy is not working. So, and in first session you can expect a lot of some questions, like the therapist would ask you some questions because they are meeting you for the first time. So they would ask you some questions to know you as a person, not just a diagnosis, right? So your background, a little background which is relevant, your hopes and expectations, what brings you to therapy, what you are looking forward to, like what do you want to change in your life, and maybe some other people in your life, your family members who know you well, they may also give their own input about what you are going through.
Right.
So some questions, some background, and therapy, and obviously there are a lot of stages through which therapy or counseling goes through. After understanding the situation, rapport building, therapeutic alliance, and assessing the problems, assessing the condition, then coming up with goal setting, like what we want to work upon. Because if you are coming with, say, 10 set of things which are disturbing you at this point of time, all 10 things cannot be targeted at the same time. So it would take some time. So a lot of patience is required. And people who are coming up with this, I understand, maybe they're very anxious, they are obviously struggling, so they want that immediate relief. So it's totally valid to feel in this manner, but this is not how therapy or counseling works. We have to be patient, we have to give some time, and also the goal is relapse prevention, so that for now you are better. What if the same things come back again? So if I don't build the capacity, if I don't build my mental immunity, then after a point, definitely when the similar stressful events are happening, I'll again break down. So preventing that breakdown, that is also one of the goals in therapy. So obviously that cannot happen in only single session. So it would take some time. It is, as she mentioned, it is a collaborative process. A lot of reflection will happen. So this is how therapy process goes.
Right. So I see that patience is the key word, but counseling or therapy works, and how do I know that it is working?
So you will see some changes. I know I frequently give this analogy of going to a gym. So if a person is a beginner to a gym, first time they are going, in the beginning even a 2 kilo dumbbell would feel very heavy. They'll not be able to pick it up, right? And over time, with practice, with repetitions, with consistency, you would see that you are able to pick it up easily. That doesn't mean that the dumbbell has lost its weight. The dumbbell is still weighing 2 kilos, but your capacity has expanded. So similarly in life also, the same stressful event which was probably earlier, which was tearing me down completely, now I have developed coping skills. So I am able to deal with those events in a helpful manner. I am probably not going into any unhelpful coping strategies, like I'm not going to I'm going into addiction or doing some other coping skills, coping techniques which are probably not helpful, probably harmful for me. So over time you will see that your reliance on unhelpful strategies would decrease. Your relationships with your significant people in your life might improve, right? You would be able to draw better boundary, right? Make better choices, right? And the same stressful event, you'll be able to feel confident enough to deal with the events, even if you fail, even if you feel difficult emotions. And because therapy is not that you will never feel difficult emotions, that something will happen after therapy that you will never feel sad or you'll never feel anxious. No, that is not the goal. You will definitely feel anxious because every human being will feel all the emotions.
Yeah.
But the aim is that without judging the emotions or pushing them away, even if the emotions are very unpleasant, still I am able to live a meaningful life. I'm living in a society, I'm meaningfully contributing to it, and you may see on daily level, you may see improvement in your daily routine. You feel like talking to people more, socializing, engaging in productive hobbies or work, so you'll see changes over time.
So, Paramita, there is something that I have often personally struggled with. Sometimes I have felt that my concerns are not serious enough. Why go for counseling? So, what do you say to that?
All right. So I feel that when I am feeling that my concerns are not serious enough, indicates that you have felt about yourself that somewhere down the line you might need it. Now you are prioritizing yourself, maybe in the family background, the social background, like whether should I go or not go, and there are multiple factors like responsibilities, monetary issues, financial factors, and all that. But then it is very important to understand that when uh, when you see that your mental health and overall well-being is compromised because your sleep is not good, you're not able to have a quality sleep. It's not only about the in hours of sleep that you're having, or maybe the appetite, whether you're enjoying the food that you're eating, whether you are able to interact with the social, in a social scenario, or engage yourself in a social setup, and also about your occupational functioning, which is like getting your work done. And often it happens that people have to put a lot of effort to get a job done. So these are the primarily three indications which reflect on our functioning on a daily basis.
Right.
If that is compromises what you feel, I think it's a high time for you to consult a therapist or a mental health professional.
Right. And in fact, that set me thinking that, for example, sometimes I have been a little concerned about my dental health and I've been to my dentist, and it has turned out that it was not very serious. But nonetheless, the visit to the dentist was helpful. It at least gave me peace of mind. So
Absolutely.
I would say, why not try it once?
Absolutely.
So, Shatavisha, sometimes people may feel that this is a problem that I should be able to handle on my own. But is that the right reason to ignore the possibility of counseling?
It's such a question which cannot be answered directly by yes or no. Yes, independence is very valuable, and that is one of the goals in therapy also, that at some point of time you grow your capacity in a way that you become independent in your decision making. That doesn't mean that when you really need help you will not seek help, because let's say somebody has a broken leg and they are not able to walk, so we'll not keep on trying to walk on our own to see how strong I am. Let me just see whether I'm able to walk or not. That would not be very wise, because I may end up even hurting my leg even more, right? So at that time we don't delay it, we go to the professional, we go to the doctor to get it treated. Similarly, when it is your mental health and you are struggling, and it is very important that seeking help when the help is available, when you can seek help, it is there, it is affordable, it is available in your situation, and it's very important that you feel no hesitation in seeking help, because you will be able to handle things on your own at some point. But right now, if you're not, it's fine. We all would need help at some point for something, so it's okay to seek that help.
So, regarding the question of affordability, some people may think that why spend money on counseling? I can handle this on my own. What do you say to that?
Yes, affordability can be a concern, and obviously we don't want affordability to become another source of stress when you are already struggling.
Right.
But there are options, there are service options where you can get the service at reduced cost, and even if you pay for this, when you're paying for the service and it is for your mental health, this is a money worth, spending, because
Right.
ultimately it is helping you feel better and make your life better because you are already struggling.
Yeah.
Right.
So now, if I have started taking counseling sessions and maybe feeling a little better, should I continue?
Yes, it's a very important question, and I feel that you need to continue until your therapist gives you some sort of a feedback that you are doing well, both mentally, physically, and functionally. I think it's the therapist's role to space out the sessions, and so the spacing out will be considered as follow-ups. So my suggestion would be for you to go for the follow-ups when the therapist would ask you to come. So for example, if I am doing therapy for about a month, let's meet 4 times a month, and then I'm spacing out the sessions for the follow-up. Even though you're feeling well, maybe in the next month 2 sessions are there, so please go for the follow-up sessions to
Right.
ensure that your well-being is still there. Yeah.
Right.
And I can also add here that if we are taking medicine for some physical health conditions, say diabetes, we are taking insulin, or we are taking medicines for hypertension, then we have to continue it for some time. We cannot just take couple of doses and stop it.
Yeah.
Because probably I am feeling better because of the presence of that medicines. Once I stop it, then I will understand how it was helping me. Then
Right.
I'll feel the problems. Similarly, because I am feeling better, I'm going to therapy because probably therapy is making me feel better. So as she also mentioned, that it is very important to continue the follow-up.
Yeah.
And you will eventually understand, you and the therapist both will discuss, you will understand that when it is the time to gradually space out the therapy session, so that you can also see whether you have gained those coping skills and whether you are able to apply those skills.
Right.
So gradually the session frequency would reduce, but it is very important to stay there, stick to it.
Another related question is that, what if I feel that life is fine, everything is hunky-dory? Do I still need counseling?
Well, I feel that's a subjective call, because all of us, including me also, if I see myself in a 1 week's 7 days span, so not every day is equal for me. So sometimes I'm up, sometimes down, sometimes like straight, like a plateau, maintaining plateau. It's like neutral and all that. But then yes, I mean, of course, I mean, if and when I feel that I need to say something, I need someone to confide to, I need that confidentiality, I need that support from somebody else. um, I I think that's a very good decision to take, to actually go and consult with someone.
No, and I would like to add one point here, that therapy is not just only crisis management. It can be growth oriented also. People who come to therapy, they may have different goals. They do not need to have a clear psychiatric diagnosis. So the goals can be relationship improvement, looking for growth, building resilience, working on your strength building, as we discussed before. So this is not only for the situations when I'm actually very much struggling, I'm having some illness, and then only I'll go and seek help.
Right. This brings to mind that a lot of people often say that therapy means that maybe I'm weak. Is that the right thing to think about?
No, rather I would say that you are self-aware enough to understand that I need help, and you are seeking help. I'll just give a very basic example. If somebody has malaria and they are going to doctor for treatment,
Yeah.
would they call themselves, as I'm a weak human being globally? No, right? Because you have a condition and you are going and seeking help.
Right.
So this is the sign of strength, rather weakness.
So Shraddha, one often hears about the role of medicines in mental health treatment. What is the difference between counseling or therapy and medication?
Okay. So as we have already discussed about how therapy works, how counseling works, it works on our thoughts, emotions, our coping skills. Medications are something which works on the neurochemicals in the brain. So I'll just break it down a little. So there are a lot of chemicals in our brain. We all keep hearing about dopamine, serotonin. So when there is, say you are under a lot of stress, there is anxiety, there is depression, so there are some changes in the levels of those neurochemicals. Medicines go inside your body and they work on the neurochemicals, and that leads to the improvement in the symptoms. So both medications and therapy are important. Now at times only therapy can be helpful for you, at times only medication can help you, at times, rather most of the times, it's a combination of both that lead to the biggest like result. And if it depends on you, this depends on the symptom severity also. If somebody is struggling and the symptom severity is so much that they are not amenable for therapy right now, like because therapy is an active collaborative process, a lot of things would be discussed which probably they, because of their symptoms, they are so overwhelmed, they are so much anxious, it's not, they are not able to just talk about it, right? So at times it is seen that when the symptoms are very severe, medications come first.
Right.
So both are important and both can coexist.
Right. So one concern about medicines is that there will be side effects, and that deters a lot of people from seeking treatment. How do we address that concern?
Yes, of course. I mean, it's a very genuine concern. So if we see that when we have all other medical problems and we take medicines and we have side effects with those medicines as well, and we go to the doctors and we seek help with regard to that. Similarly, in case of mental health problems, or when a person is taking consultation from a psychiatrist, and if there are certain side effects, then they can definitely go back to the psychiatrist, and he will monitor and manage and help the client out, and also involve family members in monitoring medication and all that. So in that way it can be solved. It's not an issue.
Right.
I would add 2 points here. One is a specific side effect people are often worried about is sedation. That what if I feel sedated, I feel drowsy the entire day, I am not able to do any work. While the fact is that yes, sedation can happen, but sedation is not like that it will happen every time or with every person, and not all the drugs which are prescribed. And if you notice that there is sedation or there is drowsiness or any other side effect, you can always take it up to your psychiatrist, discuss about it. As she mentioned, that clear communication is very important.
Right.
You communicate with the doctor, tell them whatever you are feeling, it will be sorted. Another side effect people are often worried about is what if I get addicted to it? Like another concern, another misconception people have. But let me tell you that you will not get addicted to a psychiatric drug as long as you are taking it as per doctor's prescription in correct doses, and you are maintaining a proper follow-up, and your doses are being properly monitored by the professional, by the psychiatrist, and you are not doing any self-medication, or you are not using the medicine for any other purpose rather than for your mental health. So you will not get addicted to it, right? And eventually medicines will be tapered off when the need is not there anymore. In certain situations, doctor will taper it off eventually, so will not get addicted to it.
Right. Now that you mentioned psychiatrist, what is the difference between a counselor and a psychologist and a psychiatrist?
Okay. So counselor, as we have already discussed in the beginning, that a person who is a mental health professional, and what counseling focuses on. Psychologist is again a mental health professional who focuses on therapy and non-drugs related treatment. Whereas psychiatrist is a medical doctor who has degree in medicines first, and they get additional specialized degrees in psychiatry, and they are medical doctors and they are authorized to prescribe medicines. Therapists and counselors are not authorized to prescribe medicines.
Right.
This is a very clear difference. And also psychiatrists are not usually, in our country especially, they are not all psychiatrists provide psychometric assessment or detailed psychotherapy. Many of them definitely do. They may have separate training, but psychiatrists are mainly very much important, needed for the medication purpose.
Right. And so the next question is, whom should I go to first among these three?
So you can go to anyone, any mental health professional who is available, affordable, reachable, because when you are already struggling, we don't expect you to understand all these differences and all the designations, terms and everything. So you can reach out to any mental health professional. It is better to reach out to anyone rather than not seeking help at all.
Right.
It is the responsibility of the mental health professional to guide you appropriately. So if the mental health professional, whoever you reach first, say you reach the psychologist first, and the psychologist feels that right now medicines would be needed more, it would be more helpful for you, psychologist would guide you to a psychiatrist. And similarly, if you reach out to a psychiatrist first and they feel that okay, your symptoms are not right now, it doesn't need any medications, or you can actually function without medications with only therapy, they would guide you to a therapist. So you can reach out to anyone first.
Thank you for the clarity. So Shatovisha, very often family members bring their ward or some other person with this expectation that your treatment will meet their expectations. How do you deal with this challenge?
Yes, this is a very common scenario, happens very often. Family is very important information, very important, informants, because they know the client, so obviously their inputs are valuable. But when it happens that the family comes with this expectation that tell my child to do this or not do this, or make this decision, not take up this job, not get married to someone, so they expect the therapist to play a certain role, like to give a verdict, to say who is right, who is wrong. But therapy is not about that. The therapist's role is not to give a verdict, not to take a side, not to say who is right, who is wrong, or not to impose the verdict on the person that okay, you listen to your family member, right? It's not about fixing them, right? And one of the goals in therapy is to foster autonomy, so that the client becomes autonomous enough to make their own life choices. So at times it is seen that there is some conflict going on in the family, or say in the couple unit. There obviously family therapy and couple therapy become very important. So then we refer them to family therapist, couple therapist for the holistic intervention.
Right. So Paramita, what do you think about this expectation from families?
Yeah, I think this expectations from family is very valid. They come with a lot of questions. They do not have a lot of information that how the behaviors and the emotions and the whole things. Around the client is changing. There's a sudden change, and it is very difficult for them to cope up with the changes. So they come with a lot of questions. They come with a lot of expectations as well, that how much time it will take my client to get well, to get recovered, and all this. So I think it's something very important to address all these concerns of the family members regarding their wards. And of course there would be specific therapies involved in here, and those things which are a part of it, and we can take it especially when it is required.
So thank you both, Paramita and Shatovisha. This has been a very enriching conversation. I'm sure a lot of questions have been answered for our viewers. And so friends, this much for today, but we will be back with more. Please stay tuned with this channel.